This is Dr. Donahue. I am the health director for this public health district here in the CSRA area. And we are really delighted to be kicking off a Heart Healthy campaign. It's February, and really we are reaching out to you all to answer some common questions about cardiac health and to let you know that we really want you to know your numbers. So we talked a little bit about high blood pressure earlier. And today I'm joined by Marsha Bowers, who I've known for a long time, and just wanted to see if she had any questions about her own cardiac health.
I absolutely do. It has been, I have a strong family history of heart issues, and I've always been really confused about cholesterol and how it affects your heart health. Could you explain that?
Okay, this is a really great question. Marsha, this is a question a lot of people have. So, um, very broadly, cholesterol is part of almost every cell in our bodies, actually. And it's not always a bad thing. So when babies are growing in their pregnant mom's bellies, and for those first few years of life where their brains are still developing, cholesterol is extra important. So there are good reasons to have cholesterol, but I think we're going to talk about adult cardiac cholesterol. What does that mean for the average adult? And why are we talking about cholesterol so much? So the typical cholesterol panel will include a few different numbers. I would say, to keep it simple, the most important number for you to know is your LDL. That's your low density lipoprotein, LDL. You may have heard of that as your bad cholesterol, right?
Yes.
So you're going to see in your blood work a few things: the total cholesterol, right? That's all the cholesterol. That's the good cholesterol, the bad cholesterol, and the triglycerides. So you'll see a total cholesterol number, an HDL number. That's your good cholesterol.
Okay.
The LDL number, and triglycerides. That's part of almost every single lipid panel or cholesterol panel that you'll have drawn, and that is a blood test. There are some additional tests that might be part of the panel. That's a VLDL. And increasingly, we're looking at a lipoprotein little a number too. But just to focus on basic cholesterol today. So if I were a general, adult in the world and I didn't have a medical background, if I only knew one thing about my cholesterol, I probably would want to know what my LDL was.
Okay.
So the LDL is going to be what you're targeting to look at. And what's your goal, LDL? Well, it depends a little bit on your story, right? So you said you have a strong family history.
Yes.
And big picture, lower is better, right? Lower LDL is going to be better. In general, if you were an average risk adult, so let's say you didn't have high blood pressure, you didn't have a cardiac history, usually the target number is 130 or less, and that LDL number. Change it up a little bit, right? If you had another story, if you had add on a risk factor like high blood pressure, it's probably going to be more like 120 or less.
Okay.
So here's why we target cholesterol, and specifically why we target that LDL number.
Okay.
So cholesterol is like a little fat droplet floating around through your blood vessels, right? And the LDL and the triglycerides, they can get stuck on the side of one of your blood vessels, and they're still soft, right? That's we call it a foamy plaque, right? And a lot goes on there, but if it continues to grow, it will continue to add on more and more and more plaque to it. And that's a soft foamy plaque, right? Over time, that plaque can actually obstruct that blood vessel. And that results in a heart attack or a stroke or some sort of an embolic event. So that LDL cholesterol is the most active form of cholesterol that's going to be depositing on your blood vessels.
Okay.
This is over years. It takes a long time. The name of the game is to never get that deposition in the first place, right? Prevention is always better than treatment. So the number one cholesterol thing we can do is have a healthy diet and an active lifestyle. So healthy diet looks like, smart use of fats, and increased consumption of fruit and veg, right?
Yes.
So we kind of want to get away from that processed food and look more to whole food, right? On the edges of your grocery store, those are going to be your healthiest diet options. And then, the cheapest medication going is exercise, right? So I wish we could prescribe that, because if people would exercise just a little bit, just to get that heart rate up a little bit, it goes a long way, right? In keeping your heart healthy and happy for the long run of your life.
Fantastic. Thank you. That really helps.